Hey guys, welcome back to the channel. Today we're talking about something that catches a lot of dog owners off guard. Your dog is totally fine one day, playing, eating, energetic, and then suddenly they've got this dry, honking cough that sounds almost like they've got something stuck in their throat. A lot of owners panic and think their dog is choking or swallowed something or has a collapsed lung. But more often than not, what you're dealing with is something called kennel cough. So in this video, I want to walk you through exactly what kennel cough is, why it happens, what it actually looks like, how we treat it, and most importantly, how you can prevent your dog from getting it in the first place. Let's get into it. So first things first, what actually is kennel cough? The proper medical term for it is infectious tracheobronchitis, which is a bit of a mouthful. So most of us just call it kennel cough because it spreads so easily in places where lots of dogs are together: boarding kennels, doggy daycare, grooming salons, dog parks, training classes, dog shows, basically anywhere dogs are in close contact with each other. It's essentially the canine version of what we might call a common cold in humans, though I'll explain in a bit why that comparison isn't entirely perfect. Kennel cough isn't actually caused by just one single germ. It's what we call a complex, meaning it can be triggered by a whole range of different viruses and bacteria, either alone or in combination, all of which inflame the trachea and the bronchial tubes, which is why dogs end up with that persistent cough. The most common culprit, the one that gives the condition its more technical name, is a bacteria called Bordetella bronchoseptica. This is the big one, the main player in most kennel cough cases, and it's also the one we specifically vaccinate against. But Bordetella is often not working alone. There are several viruses that frequently team up with it or cause similar symptoms on their own, including canine parainfluenza virus, canine adenovirus type 2, canine respiratory coronavirus, and sometimes even canine distemper virus can present with a similar cough in its early stages, though distemper is obviously a much more serious disease overall. What tends to happen is a dog gets infected with one of these agents first, which damages and inflames the delicate lining of the respiratory tract, and that damage makes it much easier for a secondary infection, often Bordetella, to move in and take hold. This is part of why kennel cough can sometimes seem to drag on or get worse before it gets better, because you're not always dealing with just one single infection. You're dealing with layers of irritation and infection working together. Now let's talk about how dogs actually catch this, because understanding the transmission is key to understanding why it spreads so fast in group settings. Kennel cough is primarily spread through respiratory droplets, so when an infected dog coughs, sneezes, or even just breathes out, tiny droplets containing the virus or bacteria get released into the air, and nearby dogs breathe those droplets in. It can also spread through direct contact, like dogs sniffing and greeting each other nose to nose, or through contaminated surfaces, things like shared water bowls, toys, bedding, or even the hands and clothing of people who've been handling infected dogs. This is exactly why places like boarding kennels and doggy daycares are such common hotspots for outbreaks. You've got a lot of dogs in a confined space, sharing air, sharing surfaces, sometimes stressed from being in an unfamiliar environment, which can lower their immune defenses a bit too. That combination of close contact and stress creates the perfect storm for kennel cough to spread rapidly through a group of dogs. I've seen outbreaks where one infected dog checks into a boarding facility, and within a week, half a dozen other dogs there have picked it up too. One thing that really surprises owners is how quickly a dog can start showing symptoms after exposure. The incubation period, meaning the time between when a dog is exposed to the infection and when they actually start coughing, is typically anywhere from 2 to 14 days, though most dogs will show signs within about 3 to 5 days. And here's the tricky part. Dogs can actually be contagious before they even show any symptoms themselves, and they can continue shedding the infectious agents and potentially spreading it to other dogs for weeks after they've recovered and are back to seeming completely normal. Some dogs can shed Bordetella for months in certain cases. So even a dog that looks totally fine could still potentially pass it on, which is part of why kennel cough is so good at spreading through dog populations. So now let's get into what kennel cough actually looks like, because this is what you as an owner really need to know to recognize it early. The hallmark sign, the one that gives it away almost immediately if you've heard it before, is a sudden onset, dry, hacking cough. A lot of owners describe it as sounding like a goose honking, and honestly, that's a pretty accurate description once you've heard it. It's very different from a wet, productive cough. It's harsh, it's dry, and it often comes in these sudden fits, sometimes triggered by excitement, by pulling on the leash or collar, by exercise, or even just by cold air. Something I really want to highlight here because it trips up a lot of owners is that many dogs with kennel cough often end up with this really dramatic, almost gagging or retching motion right after a coughing fit, sometimes even bringing up a bit of white foamy mucus. This looks incredibly alarming, and I completely understand why owners rush in thinking their dog is choking on something or has swallowed a foreign object. But this retching and gagging is actually a really classic and common part of kennel cough. It's basically the irritated throat and trachea trying to clear itself, and that little bit of foam is usually just mucus, not vomit from the stomach. Beyond the cough itself, most dogs with straightforward, uncomplicated kennel cough actually remain surprisingly bright and well in themselves. This is one of the really distinguishing features. They're usually still eating normally, still playing, still wagging their tail, still enthusiastic about walks, and it's really just this persistent cough that's the main issue. This is quite different from more serious respiratory illnesses, where dogs tend to become lethargic, go off their food, and generally seem unwell all over. If your dog has a cough but is otherwise acting completely normal in every other way, that's actually somewhat reassuring and points more towards a straightforward case of kennel cough. That said, some dogs will show a few other mild signs alongside the cough. Things like a mild fever, a bit of nasal discharge, sneezing, or watery eyes. Some dogs also develop a mild sensitivity in the throat area, so if you gently touch or apply light pressure to their throat or the base of their neck, they might trigger a coughing fit. This is actually something we specifically check for during a vet examination, because it's a pretty classic sign of tracheal irritation. Now, while most cases of kennel cough are mild and resolve on their own within about 1 to 3 weeks, there is a more concerning progression that owners absolutely need to watch out for. And that's when kennel cough develops into pneumonia. This is more likely to happen in puppies, senior dogs, dogs with weakened immune systems, or dogs who already have underlying respiratory or heart conditions. If you notice your dog becoming lethargic, going off their food, breathing rapidly or with obvious effort, running a high fever, or if the cough changes from that dry hacking sound to something that sounds wet, moist, or productive, these are red flags that the infection may have progressed beyond simple kennel cough and moved into the lungs, and that absolutely needs urgent veterinary attention. I really can't stress this enough. A simple cough that's otherwise not affecting your dog's energy or appetite is one thing, but a dog that's coughing and lethargic and not eating is a completely different situation that needs to be seen quickly. So let's talk about diagnosis. How we actually confirm that what we're dealing with is kennel cough. Honestly, in the vast majority of cases, diagnosing kennel cough doesn't require a whole lot of fancy testing. Most of the time, we can make a pretty confident diagnosis just based on the history and the clinical picture. A dog with a sudden onset harsh cough, who's recently been somewhere with other dogs like boarding, daycare, a grooming salon, a dog park, or a training class, and who is otherwise bright, alert, and eating well. That combination of factors is usually enough for an experienced vet to say, yes, this looks like classic kennel cough. During the physical exam, we'll often gently palpate the trachea to see if it triggers that characteristic cough reflex I mentioned earlier. And we'll listen carefully to the lungs with a stethoscope to check that the lower airways sound clear, because that helps us rule out the concern of pneumonia. If the lungs sound clear and the dog is otherwise doing well, we can usually proceed with a presumptive diagnosis of kennel cough and start appropriate management. However, if a dog is showing more concerning signs, lethargy, poor appetite, fever, or if the cough just isn't resolving the way we'd expect after a couple of weeks, we might recommend further diagnostics. This could include chest x-rays to check the lungs more thoroughly and look for any signs of pneumonia, blood tests to assess the dog's overall health, and check for signs of a more significant infection, and in some cases we can actually run specific tests, like PCR testing on nasal or throat swabs, to identify exactly which virus or bacteria is responsible. This is particularly useful in situations like a kennel or shelter outbreak, where identifying the exact pathogens involved can help guide both treatment and outbreak control measures. Now let's get into what you're probably most interested in. How do we actually treat kennel cough? For the majority of otherwise healthy adult dogs with uncomplicated kennel cough, the approach is actually fairly conservative, because in many cases, kennel cough is self-limiting, meaning it will run its course and resolve on its own within 1 to 3 weeks, similar to how a cold runs its course in people. That said, there's still quite a bit we can do to keep your dog comfortable during that time, and to reduce the risk of complications. Rest is honestly one of the most important things. I always tell owners to significantly reduce their dog's exercise and excitement level during recovery, because activity, excitement, and exertion tend to trigger more coughing fits, and constant coughing keeps that trachea and throat inflamed and irritated, which can actually prolong the recovery. So this means shorter, calmer walks, avoiding the dog park and other dogs until they're fully recovered, and generally just letting them rest and take it easy. Switching from a collar to a harness during this time is something I always recommend too, because any pressure on the throat from a collar and leash can trigger coughing fits and further irritate an already inflamed trachea. A harness takes that pressure off the neck entirely and can make a real difference in how often your dog coughs during walks. In terms of medication, for mild cases where the dog is otherwise bright and eating well, we sometimes don't need much beyond supportive care and time. But for dogs who are coughing frequently enough that it's affecting their rest, or if the cough is quite severe, we might prescribe a cough suppressant to help settle things down and let the airway have a chance to heal without being constantly irritated by the coughing itself. This needs to be a vet-prescribed medication though, appropriately dosed for your dog's size and condition. Please don't give your dog human cough medicine, because a lot of those products contain ingredients that can be toxic to dogs, or at the very least aren't dosed appropriately for them. If we suspect a significant bacterial component, particularly Bordetella, or if the dog is showing signs that suggest a secondary bacterial infection has taken hold, we may prescribe antibiotics. I do want to be honest with you here though, because a good portion of kennel cough cases are primarily viral. Antibiotics won't necessarily speed up recovery in every single case, and as a profession we're trying to be quite thoughtful about only using antibiotics when they're genuinely going to help, to avoid contributing to antibiotic resistance. So your vet will make that call based on the specific presentation of your dog's case, and if antibiotics are prescribed, it's really important to complete the full course even if your dog seems to be back to normal after just a few days. Anti-inflammatory medications can also sometimes be used to help reduce the swelling and irritation in the trachea and airways, which can help make your dog more comfortable and reduce the frequency of coughing fits while things heal. For dogs who progress to pneumonia, treatment becomes more intensive and typically involves a longer course of antibiotics, sometimes hospitalization for supportive care like intravenous fluids and oxygen support if the dog is struggling to breathe adequately, and much closer monitoring. This is exactly why I always tell owners, if your dog's condition seems to be worsening rather than improving, or if you notice those red flag signs I mentioned, lethargy, reduced appetite, labored breathing, high fever, please don't wait it out. Get them seen by a vet promptly, because catching pneumonia early makes a massive difference in how straightforward the treatment and recovery will be. A few things you can do at home to support your dog's recovery: using a humidifier in the room where your dog sleeps, or even just letting them sit in a steamy bathroom for 10 or 15 minutes while you shower, can help soothe an irritated airway, similar to how steam can help with a chesty cough in people. Make sure they always have access to fresh water, because staying hydrated helps keep the respiratory tract's natural defenses working well. If your dog seems a bit reluctant to eat due to feeling generally under the weather, warming up their food slightly, or offering something a little more appealing and easy to eat can help encourage them to keep their strength up. I also want to touch on isolation, because this is a really important part of managing kennel cough responsibly, not just for your own dog's recovery, but for preventing spread to other dogs. If your dog has kennel cough, they should be kept away from other dogs until they've fully recovered, and ideally for a couple of weeks after symptoms resolve, given that dogs can continue shedding the infectious agents even after they seem better. This means no dog parks, no daycare, no boarding, no group walks or training classes during this period. I know it can be a bit of a hassle, especially if your dog is used to a lot of social time, but it really does make a big difference in preventing outbreaks, especially if your dog has been anywhere near other dogs recently, like a kennel or grooming salon, because there's a good chance other dogs there could be incubating it too. Now let's talk about the part I think is really the most valuable: prevention. Because kennel cough is so common and spreads so easily, prevention really is your best strategy here. The cornerstone of prevention is vaccination. There is a vaccine specifically for Bordetella bronchoseptica, and it's often combined or given alongside protection for peri-influenza virus as well. This vaccine comes in a few different forms. There's an intranasal version, which is dropped directly into the nostril and tends to give quite rapid, localized immunity right at the site where the infection would normally take hold. There's an oral version that's given by mouth, and there's also an injectable version. Your vet will help you decide which form makes the most sense for your dog based on their lifestyle, temperament, and how easy it is to administer. I do want to be really clear about something important though. The Bordetella vaccine, like a lot of respiratory vaccines, doesn't guarantee your dog will never get kennel cough. Remember what we talked about earlier. that kennel cough can be caused by a whole range of different viruses and bacteria, and the vaccine specifically targets Bordetella and sometimes parainfluenza. So a vaccinated dog could still potentially pick up kennel cough from one of the other viruses in that complex. However, and this is the really important part, vaccinated dogs who do end up catching some form of kennel cough despite vaccination tend to have much milder symptoms and recover more quickly than unvaccinated dogs because their immune system already has some level of prepared defense against at least the most common culprit. This is exactly why most boarding kennels, doggy daycares, and grooming facilities require proof of Bordetella vaccination before they'll accept your dog, and honestly, I think that's a really sensible policy because it helps protect the whole population of dogs using that facility, not just your own individual dog. How often does this vaccine need to be given? This can vary a bit depending on your dog's risk level and lifestyle, but generally for dogs who are regularly in high exposure environments like boarding, daycare, or dog shows, we often recommend boosting every 6 months, whereas for lower risk dogs, annual boosting might be sufficient. Your vet can help tailor a vaccination schedule that makes sense for your specific dog's lifestyle and risk factors. Beyond vaccination, there are some practical, common sense steps you can take to reduce your dog's risk of exposure. If you're choosing a boarding facility or daycare, it's worth asking about their policies. Do they require proof of vaccination from every dog that stays there? How do they handle a dog that shows signs of illness? Do they have good ventilation and cleaning protocols? A well-run facility that takes these precautions seriously will significantly reduce the outbreak risk compared to one that doesn't ask any questions at all. If you know there's currently an outbreak of kennel cough in your local area, and this does happen sometimes, where a particular region will see a spike in cases, often word travels quickly through local dog owner groups or vet clinics, it might be worth temporarily avoiding high-traffic dog areas like busy dog parks until things settle down, especially if your dog is a puppy, senior, or has any underlying health condition that might make them more vulnerable to a more severe case. Keeping your dog's overall immune system strong through good nutrition, regular exercise, appropriate body weight, and minimizing unnecessary stress also plays a supporting role in how well their body can fight off exposure to these kinds of infections, even though it's not a direct prevention method the way vaccination is. I also want to spend a little bit of time talking about which dogs are more at risk of a severe case, because it's not the same level of concern for every dog. Puppies, particularly young puppies who haven't completed their full vaccination series yet, are more vulnerable, both because their immune systems are still developing and because they haven't built up the same level of protective immunity. Senior dogs, especially those with any underlying heart or lung conditions, are also more at risk of complications like pneumonia. Brachycephalic breeds, so your flat-faced breeds like bulldogs, pugs, French bulldogs, Boston terriers, already have some inherent respiratory challenges due to their airway anatomy, so a respiratory infection on top of that can hit them a bit harder and needs closer monitoring. And of course, any dog with a pre-existing chronic respiratory condition, a weakened immune system, or who's currently on immunosuppressive medication for another health issue is also going to be more vulnerable to a more serious course of illness. I think it's also worth addressing something owners often ask me, which is whether kennel cough can spread to other pets in the household, like cats, or to people. The good news here is that kennel cough, as we understand and diagnose it in dogs, is not considered a zoonotic disease, meaning it doesn't typically spread from dogs to humans, and it's also not something that typically affects cats in the same way. That said, if you have multiple dogs in the household, it absolutely can spread between them, so if one dog is diagnosed with kennel cough, it's sensible to keep an eye on your other dogs for similar symptoms and consider whether some separation is practical while the first dog recovers, especially if the other dogs haven't been recently vaccinated. Something else worth mentioning, because I think it helps put things in perspective, is that despite how alarming that cough can sound, kennel cough in an otherwise healthy adult dog is generally not a life-threatening condition. The vast majority of dogs recover completely with some basic supportive care and a bit of patience, and go on to live perfectly normal, healthy lives afterward with no lasting effects. The main thing we're really watching for is that small percentage of cases that progress to something more serious like pneumonia. And as long as you're keeping an eye on your dog's overall demeanor, appetite, and energy levels, and you know what warning signs to look out for, you're in a good position to catch any concerning progression early and get help promptly if needed. I also want to briefly touch on the importance of not just assuming every cough is kennel cough, because there are actually several other conditions that can cause a similar sounding cough in dogs, and it's important your vet examines your dog properly, rather than just assuming based on the sound alone. Things like a collapsing trachea, which is more common in small and toy breeds and tends to cause a similar honking cough, but is actually a structural issue with the windpipe rather than an infection. Heart disease can also cause coughing in dogs, particularly a cough that's worse at night or after lying down. And this is a completely different underlying issue that needs a very different treatment approach. Foreign bodies stuck in the throat or airway, allergic bronchitis, and even certain lungworm infections can all present with coughing that might initially look similar to kennel cough on the surface. This is really why, even though kennel cough is often diagnosable based on history and a straightforward exam, it's still valuable to have your vet actually assess your dog, rather than just assuming and waiting it out based on what you've read online. Because getting the right diagnosis means getting the right treatment. So to bring this all together, kennel cough is an incredibly common, highly contagious respiratory condition in dogs, caused by a combination of different viruses and bacteria, most notably Bordetella bronchoseptica, that spreads easily anywhere dogs are in close contact with each other. The classic sign is that sudden onset, dry honking cough, often with a bit of gagging or retching, but in most cases the dog otherwise remains bright, alert, and still eating well. Most cases are mild and resolve within 1 to 3 weeks with some rest, reduced excitement, a harness instead of a collar, and sometimes supportive medication from your vet. The real red flags to watch for are lethargy, poor appetite, fever, and breathing difficulty, because these can indicate a progression to pneumonia, which needs prompt veterinary attention. And when it comes to prevention, vaccination is really your best tool, alongside some sensible precautions around your dog's exposure to other dogs, particularly in high-traffic settings like boarding, daycare, and dog parks. If your dog has recently been coughing, especially after being somewhere with other dogs, please don't panic, but do get them checked out by your vet so we can confirm what's going on, rule out anything more serious, and get them started on the right supportive care to help them feel better as quickly and comfortably as possible. Alright guys, that wraps up today's video on kennel cough. If you found this helpful, please give it a thumbs up, subscribe to the channel if you haven't already, and drop a comment below if your dog has ever dealt with kennel cough. Or if you've got any questions about what we covered today. I read through all of your comments, and a lot of you asking similar questions is honestly what inspires a lot of my future videos. Thanks so much for watching. Take care of your furry friends, and I'll see you in the next one.